As Idaho continues its vaccine rollout, doctors across the country and right here are researching how long immunity from COVID-19 could or will last. Good evening. That's where we begin tonight. A big concern is how the vaccines continue to hold up to any of those variants of the disease. Remember, all these vaccines are still relatively new, and while authorized by the FDA, scientists are still studying the efficacy. Our Joey Prechtel is tracking the story for us tonight. And Joey, how are they getting a better look with the rollout right now in process?
Well, Mark, they're looking at participants that took part in the vaccine trials throughout the past year. Now, the good news is that a lot of those studies are about a year in at this point, and so far immunity has been looking pretty good so far. But a big variable in all of this are those variants of concern.
Whatever we can do now to slow the spread, then it would become much less of a big deal.
The concern is now setting in on the variants, as the UK variant is now the dominant strain in the U.S., according to the CDC. And on Thursday, the Idaho Department of Health and Welfare reported 81 cases of the UK strain, up by 31 last week. If the vaccines lose their efficacy against the UK or any other variant, booster shots could become a reality. Think of a flu shot where you can get one every year.
So there's some people that are thinking that might be the case, but we really just don't know yet.
However, there is good news about the 3 vaccines available to people in the U.S.
They all seem to be holding up pretty well and fortunately doing pretty well against the current variants or current strains that are out there.
But that could change if COVID-19 keeps spreading.
If it mutates enough, then the antibodies we have against the spike protein might not be effective.
At that point, if that happens, another booster shot could be the answer.
Then they would have to look at, okay, we need to create another type of vaccine or booster that would give us the protection against that variant.
But the best thing to do, according to Dr. Patrice Burgess from St. Alphonsus, get vaccinated now.
The more we can tamp this down now, we can prevent future variants from happening.
Now, in addition to choosing the vaccine, medical experts also agree that people should continue taking the same COVID-19 precautions they've been recommending throughout the pandemic. Things like wearing a mask when you go out in public, physical distancing when you go out in public, make sure you wash your hands really well with soap and hot water, and of course, try to avoid large crowds. All of this, especially if you have not yet been vaccinated. Back to you.
As we just now enter year 2 of the pandemic. All right, Joey Prechtel reporting for us tonight. Joey, thanks.